Welcome to Profits in Practice. I'm your host, Sarah Webb, and today I'm joined by Dr. Charles Van Duyne. Thanks for joining me.
Oh, well, thanks for having me.
Yeah. Well, we got connected through some mutual connections, and I just loved, honestly, I got your bio and I was like, he has done a lot of different things.
I know. As I look back, I'm amazed myself sometimes.
Well, walk us a little bit through your career.
So let me start at the very beginning.
At the beginning.
Back in high school.
Oh, okay.
Okay. And I'll try to make it as limited as possible. So in the 60s in high school, I got my first computer in math class and was completely all over the computer stuff. And it was a thing the size of a Volkswagen with paper tape in it. Okay. So I started in computer science in college. But in the 70s, we didn't have PCs and all of the stuff we have now where we take for granted the iPhone, which has more computing power than Apollo 13 had. I started out computer science, but I was not, I did not see the vision, which was coming 10 years down the road with PCs and the rest of it. I mean, the computer in our class was the size of a microwave oven and it can only count to 32. So long story short, while I was in high school, one of my high school girlfriends got me involved in medical missions. My father was a physician, so had me spend some time with some of his colleagues doing some summer rotations. And so I was kind of hooked. And so I switched to medicine at that point. So fast forward, at the time, my father told me that even though he could pay for it, that I was on my own to pay for med school. And I also worked through college because that was the way my parents did things.
Yes.
So to pay for med school, I joined the Air Force. And the only trade-off, which some people had questions about, was you owe them time for time. So they pay for 4 years of med school. I spent 4 years in the military, which I did in the Air Force after I graduated. The nice thing is I graduated with no debt. And you hear nowadays all these younger physicians are graduating with $200,000 or $300,000 in debt, which is a very bad place to be starting from when you're setting up and all the things that you want to do. The other thing I noticed while I was in the Air Force, I managed to get away with a lot of stuff because doctors are notoriously not rule followers.
That's very anti-military, isn't it?
It is. Well, my nickname was Hawkeye, so I was always in trouble, but could get away with it because if physicians, they kind of, anyway, I knew that I would not be able to make a career out of it, even though they tried to tempt me. So I got out and looked from Hawaii to Connecticut, all across the country.
Okay.
We were in Dallas. My sister-in-law lives here, and we thought this would be a great place to live. So we came to Dallas. I worked for Cigna as an employed physician for barely 2 years. I got here and realized first of all, I became department head within a year. And then I also realized I could do much better in private practice. So I set up my private practice. Now, this is in the 80s. And why do you set up private practice? Because I know that's one of the kind of, it's for autonomy and income potential is much better than being an employed physician.
Sure.
Plus my father did private practice. I had no other frame of reference. I always assumed at some point I would be in private.
What it looked like.
I could see what it looked like. I was going to do private practice. Oh, goody. So, and that's what I did. And the way I would compare private practice, solo, independent practice to employed physicians, just kind of as a kind of marker, is like an investment. So you have investments like CDs and bonds, which are very safe, predictable, and give you a certain amount of income, as opposed to equities, which have higher risk but higher reward. And that's the difference. That's private practice. High risk, but higher risk, but high reward. And so, but anyway, so you jump into that. And so that's how I ended up in private practice.
What was your specialty?
So I was OBGYN, which is and I chose that. My father happened to be an OBGYN. OBGYN is a great specialty to be in because it's a mix of medicine and surgery.
Okay.
As opposed to primary care is all medicine, surgery obviously is all surgery, and the surgical subspecialties and so forth. So you get a little bit of both the technical surgical stuff as well as the medical things that you have to deal with, which is a good combination. And plus women's health is something that, I'm very strongly passionate about because that's something that sometimes is not always focused on in a way.
Yes, I know.
Just saying. And so it's a great opportunity. And it's fun. I mean, you don't have generally you have generally good outcomes, and you can fix things. I mean, you have a baby, you do a surgery and fix a problem, and so those kind of things, as opposed to, just the other specialties just didn't do it for me. So that's
It's a
what I
natural
did.
fit. Yeah.
It was a natural fit. Plus, I'd seen it, and it's so funny that I've been in the area long enough. And 30 years ago, people would come up to me in various places, say, "Oh, you delivered so and so. Here's a picture of them when they're now 30 years old." I'm like, "Oh my goodness!" But that's something you can't put a price on. I mean, it's so cool.
Yeah, that is neat. And then so how many years were you in private practice?
So I did private practice for 20 years.
Okay.
And at the end of that time, this was now early 2000s, and I could see coming down the pike technology coming into medicine with electronic medical records and some of the other things that were on the thing. And so my technology background was kind of pulling me back in.
Had you really ever left that, or would you consider like in your private practice, were you very technology forward?
Yes,
even
to the extent you could be. I mean, I'll tell you, in the 80s, I got the first Apple computer. I should have kept the darn thing, the Apple II Plus E, because now I could sell it for a fortune. I got the first computer, and so I kept up with it. And in fact, at the one of the Air Force bases, I helped the chief nursing officer use a TRS-80, a Radio Shack computer, to build her nursing schedules.
Okay.
So I did kind of keep into it, but I could see it coming even more into especially with electronic medical records. And I mean, I had this cool little Palm Pilot thing where I could write prescriptions.
I love my Palm Pilot.
Yeah, I know. I could write prescriptions and it would send it to the printer, and I didn't have to write anything and sign anything and do all this. It was great. Anyway, so I did keep in the technology, but I'm talking more like deep tech things like digital health apps and the electronic medical record. So great. So I'm in private practice 20 years, starting to get burnt out, because when you run a private practice, you really have to be ready for it. And it's a challenge. Yeah.
It's consuming.
It's all consuming. And the things that were the hardest for me were just operational. I didn't really sign up to be HR. And I also didn't want to deal with government regulatory stuff like OSHA and all this other stuff. And there's ways around that. And I would encourage anybody who wants to do private practice to go for it. And we now today have companies that help you with that, either as an aggregate of your specialty and to any limit or to the extent that you want to let them get involved. So what I did in my private practice is I used an employee co-leasing company that provided payroll, the OSHA, all the training junk, and all the signs you have to stick up in the break room and all that kind of junk. And then, of course, you have to worry about supply chain and managing all of that stuff.
It's running a business, right?
It's running a business. It's just, it's very challenging. And I could feel after 20 years that I was starting to get burnt out. Plus, I'm getting older, and it was physically stressful to get up at 2:00 in the morning to deliver a baby, which is great because it's fun to, I'd rather get up for that than something else at 2 a.m. And, but then recovering the next day. Yeah. And when you're in solo private practice, I mean, you're it.
Right. There's no one to come behind you.
So I started looking into technology related jobs and got wind, and I could see the EMRs coming on the scene. This is just about the time that the government decided to screw things up with meaningful use. And that's a whole nother hour-long discussion. Long story short, I interviewed to work for both Epic and Cerner, which is now Oracle, which are prominent EMR vendors. And the Cerner one was great. I mean, they flew me first class up to Kansas City. I had all-day interviews with all the top people alongside another candidate. But the other candidate was half my age and has just graduated with a degree in health information technology. Yeah. So we can see how that went. So my last interview of the day was a really nice guy, and we could tell this wasn't going anywhere. So I looked at him and said, what do I need to add to my background to be successful if I want to work in this space? And he said, go back to school. So that's what I did. So I applied to graduate school. So I'm like 60 years old in graduate school at UT Houston, School of Biomedical Informatics, to get a master's in health IT.
And did you like being a student?
It was traumatic at first, I have to tell you. Because first of all, it was hybrid. But second of all, I got introduced to something I never had to deal with in college, which is called APA formatting, which anybody who's been to graduate school knows what APA formatting is. and where you get points taken off if the thing isn't exactly the way. And I was just a little frustrated because it's hard to go back being a student after 40 years. It really is. But I had great, classmates, even though they were now a third my age, which was interesting. But I eventually did really well, and I actually got a 4.0, which was
so you got great. Past the formatting.
I got past. I became the APA.
Were you like
king.
The writing center? Did you go to the writing center and all of that support that they have on campuses?
No. I just got the book, and I learned it, and I did it, and I became the APA king. And they called me the APA king and the English professor. That was my role, which was great because we had, study groups. And our class sessions were virtual, in virtual reality worlds, which is really very cool. So we had avatars, and you had to dress them and do all this stuff because that's how you would present yourself in the because you normally have a session with your teacher, your professors for the various classes, which anyway, that was a blast. Anyway, same time I closed my private practice and did locums in the meantime as well, because I knew I had to get out of private practice because I wasn't doing myself or the patients a favor. And it was a little hard to do that. Yeah. But I did it. And I had just started a new job with what became WellMed Optum. And at the same time that all this electronic medical record stuff was coming into play in the healthcare space, a role called Chief Medical Information Officer was an up-and-coming role. And the Chief Medical Information Officer for a business is the clinical person who has IT background. Because if you talk to any of your doctors, do they like their electronic medical record? Do they hate it? Do they need to use AI to write a note now, which is great? And the reason the electronic medical records were so bad is because there was no clinical input into their design and use. And the user experience for the providers is hideous. They were basically developed from billing systems.
So I'm imagining you being called into a room, or you're with a group of developers all around a table, and they're like, "We've got the greatest idea." And then you come in and you're like, "That's not going to work because of XYZ. Let's redesign it like this."
Right. You have to put it in a clinical context for first of all, the first thing is it makes sense from a medical perspective in what you're trying to accomplish. But this second piece is will this work in my workflow, in my visit? Yes. And it's gotten so much better. But they needed at the time somebody who could be kind of a universal translator between the IT technical folks who could execute what you wanted, the clinical side of it, which is what you're trying to accomplish with the thing. And also you have to throw in the business because somebody has to pay for all of this. Correct. And so that was what this role ended up being. And it was a new role. Anyway, they created the role for me. I had to write the job description, and it was great. And I had a lot of fun doing that. And as you notice, in electronic medical records is just the beginning of technology in healthcare. We've got telemedicine, and then all the plethora of digital health apps, right, and patient portals, and all of that stuff. So that all fell under me to help implement them in such a way that they actually worked for both the patients who had to use them, the staff who had to use them, and the doctors that had to use them. So that was my role at that I did at Optum and WellMed.
What is your role today?
So my role today, back up to just a little bit, 2 years ago, when Optum and United were having some headwinds because of some of their business practices. Sure. I'll just diplomatically put it that way, because I had to, I signed an NDA when they let me go 2 years ago because of budget issues. Anyway, they did some mass layoffs. So 2 years ago, I was laid off from them. So what I'm doing now is I'm working with a friend of my son's friend started an insurance brokerage consulting firm. And my role is a chief medical advisor for an insurance consulting brokerage firm, which you're like, what the hell does that mean? Right. So if you think about it, and our target audience are small and medium businesses. If you think about any employer, health benefits for their employees is number 2 and 3 on the P&L. Yes. And so that's a big, important deal. But the small and medium-sized businesses don't have access to services to help them with that. And so that's where I come in from both the clinical side, so that I can take their claims history, their employee population, look at things that we can do to help those employers spend less on their healthcare costs. And since I worked in the digital health space, one of the main things that we looked at were digital health apps that an employer could implement
Okay.
For their employees to help them with a specific, and it's very, employee population health profile specific. So for instance, navigation apps are great to help them navigate through the plan. Somebody with chronic disease, either weight loss or diabetes or, COPD, sometimes these apps help them engage and get better outcomes. Better outcomes equal less costs. And at the end of the day, you want to provide better care for the patients. And if you provide better care for the patients, the cost savings will follow.
Right. I mean, if we're healthier, we're not seeing the physician, we're not going to the emergency room.
Exactly. And so that's my role. And so it's a startup company that's just starting to get, up and running. So that's, kind of what I'm doing now in that capacity.
I like how that's a good mix of, you're bringing your technology, natural interest that you've kept quite along, but also your expertise in being a physician. And then kind of on the flip side, having been on the WellMed side and now kind of being on the other side with the broker. I think that's very unique.
Well, it's interesting. And so when I'm talking to friends, they say I've gone to the dark side, which is not true. But I mean, it's just kind of funny because, typically physicians have been at odds with insurance companies. Sure. And of course, now everybody's at odds with insurance companies.
I think it's just getting more difficult to be in private practice. And, they're your payer depending on your patient mix. It's just definitely a challenge.
Private practice is definitely a challenge. And I think, you have to be strongly motivated to put up with all the crap that you're going to have to deal with to do it. But the rewards are unbelievable. And I would encourage anybody in the world to do it that wants to try it. And I think there are resources out there for these providers, at least, and I can only speak for the state of Texas. Texas Medical Association has a lot of good resources for that. And interestingly, if you look at the state, the majority of physicians are in employed arrangements. The majority of membership of Texas Medical Association are independent practitioners. So there's some resources there. And then there's, like I mentioned before, companies like Privia, which, works with independent practices to provide that support function behind them. Talk to people. And when I started, I talked to every person I could who had done it before and has learned the mistakes they made and all this other kind of things. And so if I had to go back and do two things differently, I wouldn't have rented my office. I would have owned my office. And secondly, I would have connected much sooner with either a national or local organization to help with some of the business aspects of doing the practice. Because, you've got, marketing, revenue cycle, all these pieces that you have to corral to do in private practice. I think, and the other thing that I would say for private practice is one of the things that you can consider is developing additional revenue streams besides direct patient care. And that can be anything from having a concierge or DPC, direct primary care practice on the side, depending on your specialty. That's the other thing I should point out. How you do your private practice is very specialty dependent. So if you're in a specialty, like there's a national organization that helps dermatology groups and a national one that does GI. If your primary care, you interestingly have a lot more options because there's things on the table like virtual primary care. And like I said, DPC, my own primary care doc is a direct primary care doc. So it's a monthly subscription fee. But from a business perspective for your practice, that's money that comes in the door every month that you don't have to chase down and deal with the insurance companies on. So that's a thing to do. And concierge, of course, you can either do all that, do it hybrid. Now, some of the other things that are, I will call them gray areas because some people have no problem doing and other people think it's not appropriate to do them. And that's things like medical spa and all cash services like Botox and some of those other things. And, I didn't go that route, but some people see the need to do that. And it doesn't have to be your whole practice. But if you can use that just to keep the lights on, then you can do what you really want to do with the patients. And you have to make those concessions. Yeah. And, I would say, but you really have to want to do it so bad that you're willing to put up with tripping and falling and having everything, one of the things that got me the most was being screwed over by the patients, and you feel bad when they stiff you.
Yeah.
But we never sent anybody to collections. I mean, I just didn't have the heart to do it because but it's a business, and you really have to be prepared for patients, doing that. And it puts you in an awkward position because
Sure.
you're the doctor, you're altruistic, you want to help these people, but yet they do these things to you. And that was kind of a challenge, but that was not the majority of the patients, fortunately. So most of the other physicians I know that were in private practice are so glad they did it at the end of the day after you get past the hump. Now, like I said, nowadays, since I've been out of it for a while, the other thing I would say is that you can only do so much work as an individual. So one of the other things that the successful private practices do is they hire additional advanced practitioners
Yes.
to expand the ability, their
ability
throughput,
to reach.
their
Yes.
throughput and their access. Because that's one of the biggest problems today is access, getting in, to get into your primary care. It may take 3 weeks. Well, that doesn't do me any good if I have a problem now.
Yeah. I think you've touched on quite a few things that we've talked about in multiple episodes. One, I'm always about owning your own building if that's a possibility from a tax advantage and wealth building.
I should have listened to my wife.
Yeah. Well, I say that a lot too. But I think the other thing when you talked about multiple revenue streams, I agree. I don't see a lot of private practices thriving unless they have few different things going on. And depending on their specialty, and I'm not talking about being out of bounds.
Right.
I'm talking about what makes sense for you as a physician that you can do to add to your practice and adds to your patient outcomes. Some of the things that I've seen is getting involved with clinical research, speaking, being a speaker and learning different things. I'm personally involved in a lot of practice management type organizations where we are trying to help physicians and give them the best practices of hiring, because managing people is hard. So those are a lot of the Texas Medical Association. And, when I look at medical associations across the United States, I think the mix of you talking about the employed members versus the independent clinics. Yes, that's a consistency that I see across the United States of they're wanting those types of resources from their medical association. And there are lots of resources there. And so it's just a mix of, the employed versus the private practice.
For sure.
Well, thank you so much for joining us. I loved hearing about your career. I love how you kept the technology interest that you even had as a teenager. And that really was a common thread throughout all the things that you did.
You're right. I was a teenager when it started. I wasn't in high school.
That's what you said. I didn't.
I know that, but I just kind of realized that being, kind of old now.
No, I think we're only as old as we feel. And I think the way that you're capitalizing on your experience is not only great for private practices and businesses that are getting through this insurance, but also it's still focused on the patient, right? So how are we using technology to drive better outcomes? How are we helping people lose weight through daily reminders?
And that's the other thing I would tell you is I was on a panel at UT Southwestern speaking to fourth-year medical students about, and I forget what the topic was, but because I had several counterparts of my vintage, and the overwhelming message of how to approach the whole mess that's out there, because there's just a lot of stuff going on, is your North Star always needs to be the patient. Mm-hmm. And you always focus on, what's best for the patient. Why are we here is to help the patient. And if you focus on that, all the other stuff, and if the stuff anything you do or think about or do has to end up contributing to that particular goal, is what can I do for this patient? And you have to, and sometimes it's hard to keep that in mind when you're, bombarded with, prior authorizations and inbox messages and all this other junk that's out there that detracts from you being able to see and take care of your patients. But if you focus on that and this is one of the things that a lot of physicians have complain about is losing the joy of medicine, is you have to keep that in the forefront on purpose so that you can tolerate all the other garbage that you have to deal with. And if you just focus on that, it'll more than compensate in most cases for all the negative things of it. And just like I said, having patients come up to me 30 years later and showing me a picture of their kid, it's like, how can't beat that.
Yeah, I love that. Well, thank you so much for joining us today. I've really enjoyed the conversation. Thanks for joining me on Profits in Practice. If you found today's episode helpful, be sure to subscribe, leave a review, and share it with a fellow physician. Your financial wellness is just as important as your patient's health, and we're here to help you thrive. Connect with us via our website at webcfo.com. Thanks for joining us.